Dear audience, dear chair, welcome to the first progress report. I would like to introduce my PhD title to you. It is Assisted Reproductive Technology. I am Begüm Kepkep. I'm from Istanbul, Turkey. And we started this project with this PhD with a vision of decreased psychological burden on couples during assisted reproduction. And our mission to meet our vision is to find safe and effective techniques to increase the success of assisted reproduction. We have two specific goals and two ongoing projects. The first one started in September 2024, and the second one started in November 2024. Let me introduce the first one. The first one is titled under Investigating the Effect of oocyte gene mutations on Fertility Outcomes During Assisted Reproductive Technology. As a background, as we all know, infertility is becoming a global issue, and around 15% of couples are having troubles conceiving. We are using so-called assisted reproductive technology as the first-line therapy for these couples. Even though with the help of ART, some couples cannot conceive due to a phenomenon called total fertilization failure. This phenomenon occurs in every 5 to 10% of IVF cycles. There can be various etiologies behind this phenomenon, but we think and we aim in our study to look into several oocyte gene mutations which can be cause of this problem. Some of the examples are WEE2, PATL2, and TUBB8. These mutations cause maturation arrests in the oocyte phase maturation phases, and as we all know, we cannot fertilize the oocyte if they don't complete their maturation phases. Our aim is to conduct a research which investigates the relationship between of oocyte mutations and total fertility failure. Our clinical question is, does having certain oocyte gene mutations increase the risk of total fertility failure and result in lower fertilization rates? We use a PECO framework in this project. Our population is women undergoing ART. Our exposure is oocyte gene mutations, and our comparator is no mutation. Our primary outcome is total fertility failure, and our secondary outcome is fertility rates. We hypothesize that having certain oocyte gene mutations increase the risk of total fertility failure and result in low fertility rates. Our clinical and research implication is hopefully being able to create a genetic panel according to our results. We have 3 key articles for the mutated population. Let me talk about the strengths and limitations. The strengths of our mutated population articles are that genetic test is done for all of the participants. They give detailed patient data for exposure groups. And in these tables, they give also detailed information about IVF or EC cycle information per patient. Our limitations are that these studies are single-arm studies, and they do not report any data about the non-mutated population. Therefore, we have 2 sets of key articles. The first one goes for the mutated population, and the second one is for the non-mutated population. We are able to use these control group articles for the non-mutated population because the prevalence of these mutations are quite low. So we can assume that a general study which do not even do a genetic mutation testing can give results of no mutated, can give us information about the non-mutated population. We have a search key which is composed of 2 domains, and the first domain is representing the population, whereas the second domain is for our outcomes. We used 2 different domain 2 for the PubMed and the Embase. We used a different function, TIAB, for the title and abstract filtering. Right now, we have registered the Prospero, and then we've done the duplicate removal, but we will be doing the title abstract selection in the upcoming weeks with my co-investigator, Mate. As a result of the duplicate removals, right now we have 7,550 articles. Let me go to the second project. Our second project is titled under Investigating the Effect of Antioxidants in IVF Media on the Fertility Outcomes During Assisted Reproductive Technology. as a background, we have around 500,000 IVF deliveries every year worldwide. And during this process, we have the cellular metabolism going on in the media, of course. And then we have the reactive oxygen species production as the result of the cellular metabolism. The production of ROS accumulates over the course of embryo development in the media, and it's affecting negatively the IVF outcomes. ROS can be reduced and counterbalanced by the help of antioxidants in the media. Some examples of these antioxidants can be acetyl-L-carnitine and acetyl-L-cysteine and alpha-lipoic acid. We aim to investigate the possible positive effects of using these exogenous antioxidants in our IVF media. The clinical question is, does using antioxidants in IVF and EC media result in better fertility outcomes? We use PICO framework, wherein the population is the woman undergoing ART, the intervention is antioxidant use in IVF EC media, and the comparator is no antioxidant use. The outcomes would be fertilization rates, pre-implantation embryo development, and we hypothesize in this project that using antioxidants in the culture media results in better fertility outcomes. Our clinical and research implication would be increase in fertility. We've only done a preliminary search, and the first domain here again represents the population, and the second domain this time is for the intervention group. We have 3 key articles, which all of them are randomized controlled trials. The intervention in these articles are media with antioxidants, and then the comparator is media without antioxidants. The outcomes are quite similar to each other. They are investigating the fertility outcomes and the pre-implantation embryo development. So, as a summary, we have 2 ongoing projects, and the first one we aim to publish on September 2025, and the second one hopefully by February 2026. I would like to end my presentation with a quote from Albert Einstein. It's not that I'm so smart, it's just that I stay with problems longer. Thank you for your kind attention.
Thank you, Begüm. This nice presentation. Any questions or comments, please?
Thank you for your nice presentation.
I
would like to ask that for the intervention, you're using antibiotics. Is there any dosage, or it's just
I'm using antioxidants.
Antioxidants, yeah. You have any dosage in this? Or it's a yes or no, use or no?
Yeah.
You have dosage?
No. To be honest, I had a lot of problems with my first project, and I love this quote from Albert Einstein because I had a lot of struggles with my first project. So I didn't really have time to dig in very details to my second project, but hopefully right now we have progress in our first project, and then I will have more time to be with my second project more.
Thank you so much.
Thank you for the question.
Brilliant presentation, brilliant progress.
Thank you.
You mentioned these gene mutations. What kind of tests do the articles use to detect these?
So we can do DNA sequencing from the peripheral blood, which is quite easy, and it's just a 5-minute procedure, and the DNA sequencing, of course, takes time, but for the patient part, you just give blood, and then the geneticist can do the testing part.
Hi, well done for your progress. I think we can all say that we saw your struggles, and well done for this that you achieved. For the first project, I have the question that I asked last time. Do you know, and you couldn't answer, but maybe you have now the answer, that what is the amount of this gene mutation in the general population if you compare them to the general population?
Yeah.
Thank you.
So I had the time to do the genetic database search by myself. I did it by myself. And I could only do for the WEE2 mutation. I did the database search according to the mutation variants I found in my key articles. And and I have more than 3 key articles, but I didn't want to bore you with all of them. So I just did the analysis, and it's 0.2% for WEE2 mutation.
One question here also. So for the first project, how do you measure or how do you define the total fertility failure?
So it is measured. We measure them with the data that they give us. It's a yes or no question. So if you have oocytes and then you put them in the fertilization media and then you open the door again in the next morning, and if you don't see any embryos or zygotes, it's called total fertilization failure. If you even have one zygote from maybe 10 oocytes, I don't know, it's not called as total fertility failure because you have even just one, but you have one, so it's not a total fertility failure.
Thank you very much.
Thank you, it was a nice talk, and my question is for the first topic is, do you consider making subgroups from age, by age, because as you know, a patient's age has a high effect on the oocyte.
Yes. Thank you for the question. And yes, we're planning on doing the subgroup analysis according to the data we collect in the articles, from the articles.
Okay, thank you. And for the second topic is, do you investigate one-step culture media or multiple-step culture media for the embryos?
If I understand your question correctly, we will investigate the IVF and the intracytoplasmic sperm injection medias.
So just the media that the fertilization happens in?
Yes, yes,
okay.
yes.
Thank you.
Because our aim is to investigate that in the human body we have our own antioxidants that are produced endogenously, but of course in vitro we don't have any bodily situation, so we have to put them if we want them there. So we're investigating if adding them exogenously to the media helps with the fertilization outcomes.
Okay, thank you.
Thank you.